My name is Maxine M. I'm 48 years old. I'm married with one adult daughter and 2 grandchildren. I live in Dawlish and I'm a yoga teacher and massage therapist. I've always been a very fit and healthy, active sports person and outdoors person. I used to have a very active job. Last year, in about March, I changed my diet over to a vegan diet, and then in about July I started suffering from some quite prominent symptoms. I had about 20 to 30 dizzy spells a day, lasting for more than 30 to 40 seconds each time, and that would be when I got up, just sometimes when I was standing there, and sometimes very occasionally when I was sitting. I started to feel out of breath a lot, and it felt like I was breathing through a muslin cloth. It seemed like there was some resistance and I couldn't get enough air into my lungs. I started having a really heavy feeling on my chest, as if there was a weight on the top of my chest, and I had some really thumping heartbeats every now and again, and I felt very, very fatigued. Excessively so, and I would sleep often an hour or 2 during the day, as well as my sort of 8 hours at night, because I just felt so tired. I was quite forgetful. My memory was really difficult, and I kept fumbling my words. Couldn't find the right word, and even when I was speaking, I just kept the wrong words kept coming out, and I stuttered a little bit, which was quite difficult because I teach yoga, and so that was quite difficult during my classes. And I'd noticed that as the weeks went on, when I was out riding my bicycle and swimming and walking, I would notice that I would really get some really strong chest pain right in the centre of my chest. And there was a couple of occasions where I was riding my bike and I had a heart rate monitor on to monitor my distance and my speed and how I was working. And I started to feel really dizzy, and I started to have some heavy chest pain, and then I really had lots of nausea, excessive nausea, so I stopped. When I looked at my heart rate monitor, my heart rate had gone up to 183 beats a minute, which at the speed I was doing on the flat, it would normally be around 130 at the rate that I was working. And so I'd stopped, and then when I tried to carry on riding my bike just to go home because I felt unwell, my heart rate didn't go back down. It went down to about 150. It wouldn't go down any further, and then it kept rising up into the 170s and 180s. And from that point on, my heart rate was racing continually, and whereas I used to have a resting heart rate of around about 60, 64, it went to 104, 110, 114, even just when I was sitting down. And it developed an irregular pattern, so it was missing some beats, and it just kept in its upper range, even when I was just walking along the flat quite slowly, and I had no control over it whatsoever. And it severely impacted my day-to-day life. I couldn't swim, I couldn't bike ride, and I couldn't do any walking. And I noticed that when I was teaching yoga, I quite often had dizzy spells during the yoga class, and it was difficult to cover them up so that I didn't let people know that I was feeling unwell. And the fatigue was very, very difficult. I was sleeping a lot and not able to do very much during the day. So it was quite an impact, and of course I was worried. So I had those symptoms for about a month, and after they didn't settle, I went to my GP, who became a little alarmed and put me on an ECG straight away. Had lots of blood tests to test whether I was anemic or whether I had any levels in my blood that weren't right. So the test came back and my blood levels were all completely satisfactory. I wasn't deficient in anything, so it was decided that it wasn't anything to do with my diet, even though the timing seemed very close. It was initially sort of diagnosed as having atrial fibrillation, and I was advised to stop all physical activity other than yoga and very gentle walking, which I did. I was also taking some medication for a hip injury that I had had, and I was advised to stop taking all medication because there was apparently a side effect that could affect me and affect my heart even further, which I did. I was referred to a cardiologist where I underwent a series of tests, and it was being discussed that because it looked like I had atrial fibrillation, that there's a way to stop the atrial fibrillation, which is where the heart isn't pumping blood properly around, a way that they deal with that, and it was being suggested to me, was that they had put some wires and medical bits and pieces into my heart through my groin, and would burn parts of my heart in order to prevent the heart beating in an irregular way and not pumping the blood correctly around the system, which was a bit alarming. I had tried some therapy known as Reiki, which I had 2 sessions, and I found that whilst emotionally the therapy made me feel better, it didn't actually have any impact on the behaviour of my heart at the time, and my heart and my symptoms continued in the way that I've described. I had my first session in December, at the beginning of December of the same year that I started experiencing the symptoms, and I was made to feel very welcome. I ran through a brief history of some of the symptoms that I had been suffering, and these were taken down in the form of notes, and it was explained to me that the notes would be confidential, so I was happy with that. And I was asked a number of questions about my physical health at the time and previously, and once it had been explained to me how the dowsing would work, I was offered a book to read, because when the dowsing is being done, there's a period of time where it's quite quiet, and I was just sitting there, so I was offered a book on dowsing to read while I was there, which was a really good thing, because it helped fill in the gaps of some of the questions that I might have wanted to ask, and I found it very interesting and informative. And during the session, which I think lasted about an hour initially because of all the history that I went through, the dowsing was done, and then I was offered some information and some explanation as to where some of the problems and some of the symptoms might have been originating from. And it was explained to me that it was at certain points in my life there might have where the problems had originated from. I wasn't asked for detail about what was going on in my life at that time, although I did feel that I could have offered it and said if I wanted to. And then there was some more dowsing that was done, and I was allowed to read the book for a little bit more. And then the next point was where I was given an explanation, a slightly more in-depth explanation about where the dowsing had identified that the symptoms were originating from, and I was given a bit of I was shown a diagram in a book about anatomically where they might have been coming from, and I had it explained. And then there was a little bit more dowsing that was done, so I was able to go back to reading the book. And then at the next point, I was offered a code to be given to me via the dowsing, and to help start dealing with the symptoms, but not at the point of the symptoms. It was actually dealing at the point of the origination of the symptoms. So getting to the bottom of it and dealing with the beginning, not just dealing with the symptoms, which was very quick and easy. It just meant that I placed my hand out, and my palm was touched, and after a period of time I was told that was that code had gone through and it was completed. I have to say that although it might have seemed odd to some people that it was quiet for the majority of the time, actually it wasn't uncomfortable at all. And I really found the book helpful because it helped answer a lot of questions that I had at the time. And I was given a time frame for the code to work, and I had an appointment to come back, and I did so, and some further dowsing was done, and it followed the same format. It initially started with being made to feel comfortable, being offered a drink, and asking for an update. I was asked for an update on my symptoms, and dowsing was done to check where I was in my body, and then I was given another code and told that it would be a number of days for that to work its way through my system. And then I came back for a third appointment, and again it followed the same pattern as the other two, but the last two appointments were slightly quicker because I didn't have to go through so much in the beginning. And again I was given an update about how I was feeling, and the dowsing was done to check, and all the while I had the option to keep reading the same book that I was offered in the first one, so I could actually pick up where I left off. And then at the end, I was informed that the code had been evaluated as being successful, and it was actually graded as how successful it had been in terms of percentage. And that certainly helped me in understanding what was being done with the dowsing. From the first session that I had, right the way through until the third session that I had with the dowsing, I did start to notice a gradual reduction in the frequency of the symptoms, and as time went on, and certainly past the second session, I noticed that the severity of the symptoms were less. So for example, the first thing that I realised was the heavy weight feeling, as if there was something on my chest, a heavy weight on my chest, and the chest pains started to become less frequent. The dizzy spells reduced fairly quickly. They went from 20 to 30 a day down to about 10, and that was fairly quickly after the first session. And gradually they dropped away. So from having 20 to 30 dizzy spells a day, I went down to about 3 a week. And eventually it seemed to me that all the symptoms petered out. And during this time that I was having the sessions with the dowsing, that was the time where I was having periodic ECG traces as to what my heart was doing. And I was on a waiting list to have some further tests. So I had an echosonogram, which looked at my heart and imaged my heart. And on one of the ECGs that I had had, the cardiologist had noted that I had a long gap between electrical charges in my heartbeat, and said that this was something to note. And also that there was some evidence from the trace that I might have an enlarged heart. So by the time I got to having the further tests, so the echosonogram and an exercise stress test, I'd completed the sessions with the dowsing, and when I had the tests, there was no enlargement of my heart from the sonogram, and there was nothing to indicate that there should be any reason for any difficulties. I went on to have further ECGs, which noted that the long gap between the electrical charge, which had previously been seen before I started having sessions with dowsing, that gap had now gone back into the normal range. And I had had a 24-hour heart rate monitor on. So I'd had one at the beginning, before the sessions with the dowsing, and I'd had one after. And it was noted that there was nothing significant. There was no atrial fibrillation. And then I went on further to have an exercise stress test, where I was had an ECG monitor and a blood pressure monitor, and I was placed on a treadmill. And gradually, the treadmill, the speed was increased and the incline was increased, so it was placing me under quite a lot of physical stress, to the point where I eventually had to start running. And throughout the time on the test, I didn't feel any symptoms at all that I'd previously suffered from. And the ECG that was constantly running throughout the whole test did not indicate any abnormalities. There was no atrial fibrillation, there was no missed heartbeats, there was no difficulties, there was no anomalies, absolutely nothing. And I was able to get up to 105% of my maximum heart rate, which is over what it should maximally do for my age. And I still felt no ill effects, symptoms, and I had nothing measurable on the equipment. And there's been no explanation that's been offered to me, and in fact the cardiologist sort of scratched his head and said, I don't know why this has happened, I don't know why, but it would seem, and his opinion was that it was fairly safe for me to start exercising again. And I can certainly say that from the time that the symptoms first started, and I started going to the GP and having referrals and lots of tests, medical tests, it was always explained to me that there was a possibility that my heart could just stop, or I could have a stroke. So I was advised not to do anything strenuous at all, try not to let anybody scare me or make me jump inadvertently, and that I shouldn't go too far away from an urban area in case something happened and I needed some medical assistance. It was really quite frightening, and I felt that I was being told that at some stage it was possible that I might just die, and that had a really upsetting effect on myself. I was afraid to be out alone, and it was upsetting for my family. Having been through the sessions and having the final medical tests that I've just described, I can say that I feel well. All the symptoms have gone, and I'm no longer afraid, and I just feel absolutely well, and that has been such a relief for me. I feel like I did before the symptoms came along, just normal, fit, healthy, able to exercise and enjoy life. Yes, and I've not been able to have been given an explanation from medical professionals as to why the symptoms were there and why they've gone. But of course, I've had some sessions in between that they're not aware of with dowsing.